welcome back. Now, last month we raised the issue of how 0 hours contracts for home care staff were damaging services to elderly people. The company Allied Healthcare, which employs 15,000 people on such contracts, has now offered to put them all on contracted hours. But staff that we've spoken to say that the change offers very little improvement because they still will not be paid for the time that it takes to travel between clients. Our business correspondent Siobhan Kennedy explains.
The name Saga is synonymous with the elderly, yet the widespread use of 0 hours contracts for its care workers puts the very people they're supposed to be caring for at risk. Last month, this programme joined one care worker, Rochelle Monti, on her rounds visiting the elderly in Newcastle. She works for Allied Healthcare, one of the biggest names in the industry, that was bought by Saga back in 2011. Rochelle asked not to be identified, but she wanted to expose how her working conditions affect those she's caring for.
The whole system of 0 hours within the home care sector leads directly to a huge turnover of staff. It's an unstable environment, people leave, and the lack of continuity, the lack of experience of staff coming into the system means that people are put at risk.
0 hours means no guaranteed work and jobs that can be cancelled at the drop of a hat. And crucially, because staff don't get paid for travel time between visits, many of them end up getting paid below the minimum wage per hour.
Well, now, dramatically, the woman who started and ended
Rochelle felt so strongly about the issue, she decided to break cover and go head-to-head with the man who runs Allied, her boss. That was a month ago. Today, I brought them back together again after Allied announced it's finally ditching 0 hours contracts and will offer its 15,000 workers guaranteed hours instead. Why have you made that move?
Well, I mean, we feel that it's the right thing to do. If we want to provide the best quality care, we need the best quality care workers. We want to make it an interesting, attractive career for people. And the best way to do that is to start to make the conditions of service better than they have been.
Presumably, you're really happy today. This is what you were asking for and this is what you've now been given.
I think in principle the idea of guaranteed contracted hours are a wonderful idea, but unless you address the issue of non-payment of travel time, guaranteed hours don't work.
What do you mean, Rochelle? Explain that to us.
So the likelihood is I may have to travel 30 minutes between each call. That's time I'm not getting paid. That's time I'm still at work, but I'm not getting paid for.
Clearly the big issue for Rochelle and others like her is the fact that getting from client to client, she is not paid.
Yeah, there is a huge issue for care workers in terms of the clarity, the pay arrangements, and that is being addressed. We can't do everything at once. And we are today making a first important step down that journey.
Rochelle's shaking her head though.
You don't agree this is a big step?
No, I don't think this is the best step at all. This isn't addressing the issues within the sector. What good is a guaranteed 18 hours to me? I might have to work 25 hours because of unpaid travel time to claim that claim.
We've already started a branch by branch pay review, but we cannot do 200 branches overnight. We've got to do it.
I would happily accept a contract, no problem at all, if it included travel time.
Well, that's not what we're announcing today. What we're announcing today is a guaranteed hours. We are also being really clear.
I'm asking you, will you then say, and part B will be guaranteed pay for travel? I know you're going branch by branch, but it really is just a yes or a no.
Well, I think we need to be really clear so that our 15,000 workers out there understand what we're doing, and we are going branch by branch, reviewing pay, and part of that process is absolute clarity so they can see that they're being paid for their contact time and their travel between customers.
0 hours contracts are a big issue across many industries, so it is progress that Britain's biggest home care provider is trying to address the issue. But until the industry as a whole pays its workers travel time, critics say it's the elderly who will continue to suffer.